What does HIPAA mean to you in the workplace?
Patients' privacy is a high priority. We need to keep patients' medical records private.
What does it mean to you as a patient?
That I am protected with or without my consent.
The Health Insurance Portability and Accountability Act, or HIPAA, was enacted in 1996. It is essential within the healthcare field to keep patients' personal health information protected and confidential. Doctors and other medical professionals must follow this law and make the daily decision to ethically maintain patient privacy while considering general public health and safety. Other medical providers also have an ethical responsibility to inform patients of their rights and choices in their healthcare. The right to privacy in healthcare, health insurance, and other health-related fields in the United States is imperative. It sets a national standard to protect medical records and personal health information and give patients control over their information. Creating boundaries and standardizing an informed patient, or when the patient is aware of their medical history, generates more trust in the healthcare system, a key goal when creating HIPAA.
In a nation with an unreliable healthcare and insurance system, HIPAA became a pivotal article of legislation that brought rights to an otherwise ill-informed patient and responsibilities to healthcare professionals with no standard of patient protection. Initially, congressmen proposed HIPAA to reform the health insurance market in the United States, as there was very little to cover anyone. It evolved into what it is today as a compromise because of the lack of legislative support. Prior to the enactment of HIPAA in 1996 and enforcement in 2003, there was no structure to the healthcare system and no perceived need for one. Employee-sponsored healthcare became our structure, but the first instance of employee-sponsored healthcare was in 1929 when school teachers couldn't keep up with their health bills. The administrator at Baylor University noticed this and began to provide healthcare for $6 annually through Blue Cross Blue Shield. This quickly became the norm, gaining popularity and creating demand within the system.
During World War II, employer-sponsored health insurance became a way for employers to compete for their employees. In the wake of this, in 1943, under President Franklin D. Roosevelt, the IRS made employee-sponsored health care tax-free. This made it cheaper for Americans to receive health care through their employers. For the first time, Americans were shopping for the best job based on the health insurance they provided. Shortly after, in 1945, President Truman proposed that Americans use a national health insurance model. The proposal was seen as anti-American due to the widely accepted view that socialism was communism. In 1965, President Lyndon B. Johnson made what is known as the Social Security Amendments, which greatly benefited the American public in several ways, beginning with the addition of Medicare and Medicaid. Medicare is the federal health insurance for those 65 and older. Medicaid is the joint federal and state program that gives health coverage to some people with limited income. These were the first movements to create government-funded health care. In its first 6 months, it covered more than 2.5 million Americans.
During the 1970s, Congress proposed several bills modeling the beverage healthcare model, in which the government would fund health insurance. They all eventually lost traction, preventing the bills from passing. On July 7, 1995, Senators Ted Kennedy and Nancy Kassebaum proposed the Health Insurance Reform Act to Congress. The bill was intended to change the health insurance and healthcare industry by removing healthcare ties to a person's employer. It introduced the concept of portability in healthcare, which would mean a person's health insurance could stay with them even after leaving one job for another. The bill eventually lost its footing. However, on March 18, 1996, the original drafting for HIPAA was introduced to Congress. Originally called the Health Coverage Availability and Affordability Act, it was intended to make health insurance available to all Americans by making it affordable and mandating a system to enforce it.
Congress struggled to pass this bill as more affordable health insurance had been historically spoken against. Congress did, however, reach an agreement and compromised on the bill, renaming it the Health Insurance Portability and Accountability Act. This new bill had several parts to it. Each is important to how we know healthcare today. The privacy rule dictates use and disclosure of patient information, keeping it private and limiting when and where doctors can give patient information. The security rule addressed physical, technical, and administrative security measures to protect patient information. The breach notification rule established guidelines for reporting violations of HIPAA. A notable part of these guidelines is a stipulation that the patient whose records were breached must be notified within 60 days of the breach. This paved the way for patients as informed decision makers. The enforcement rule provides regulations on maintaining HIPAA. The omnibus rule outlines how business should be handled, protected health information, or PHI. Some of these rules have been added post-HIPAA enactment as a response to misconduct in the health industry in regards to HIPAA. On August 21, 1996, President Bill Clinton officially signed HIPAA into law.
After the initial enactment of HIPAA, it underwent several changes before the final version was put out in 2002. The security rule was proposed in August of 1998, covering improved security standards for the health plans and providers. It addressed the use of electronic signatures and protocol for using it and keeping it private. The privacy rule was proposed in 1999 and issued in December of 2000. The rule underwent corrections the day after it was issued. These corrections covered compliance dates and access to protected health information. This rule was delayed during the Bush administration, and modifications weren't completed until March of 2002. The healthcare providers were expected to comply by April 14, 2003. All healthcare providers were mandated to allow patients to access their records, and limits were placed on when and to whom a provider can send the health information.
HIPAA affects my job every day, all day long. When speaking to a patient on the phone, I have to use 2 patient identifiers, making sure that family members are on signed consents by patients and that the consent is updated annually. Medical records, diagnoses, treatments, patient appointment date and times are kept confidential. Conversations with my coworkers regarding patients have to be kept in a private area, away from any public areas, to prevent unauthorized people from listening. If I find out that a violation or a breach of confidentiality occurs, then I have to write an incident report.
How does HIPAA directly affect your job?
If we don't follow the rules and patient's information is breached due to, for example, me, then I can lose my job.
The penalty for the person or entity responsible for a breach of HIPAA will be handled by their internal manager, can be terminated of employment, sanctioned from professional boards, fined up to $50,000, and/or imprisonment up to 1 year for knowingly obtaining or disclosing an individual's private or identifiable health information.
The adoption of using electronic health records to exchange and share patient health information was promoted to help strengthen HIPAA security. This adoption is a part of the HITECH Act, which was put in place as a law in the U.S. The HITECH Act was first introduced in 2008, where only 10% of hospitals and clinics adopted this concept. Entering 2009, the HITECH Act became more enforced into hospital, clinics, and other healthcare facilities to better ensure the privacy of the patients.
I have worked in healthcare for many years and have had the privilege of being part of paper charts to electronic medical record transition. New safeguards for electronic systems had to be updated to include safeguards such as the HITECH 2009 Act.
The Affordable Care Act was signed into law by President Obama on March 23, 2010. It is known informally as Obamacare. In 2014, some of the ACA's major provisions came into effect, like the contraceptive mandate for women's health coverage, the preventative health mandate for mandatory screenings, and the chronic illness mandate for medication evaluations. This is the biggest adjustment of the U.S. healthcare system since Medicare and Medicaid.
In the wake of all these changes, the climate around the patient's role in their own healthcare changed. For the first time, the patient was considered an informed decision maker in their healthcare. They were encouraged to be informed of their choices and their options to participate in health studies. Healthcare workers and data scientists were tasked with balancing patient privacy and general public health. Certain situations, like the recent COVID pandemic, required that anonymous health data was used for the good of the people to predict and analyze trends in health data relating to the spread of COVID. This was done with the intention of benefiting society, with an overall aim of keeping specific records and the names attached to them private. Though it has greatly improved our healthcare system, there are still issues being worked out. Some concerns exist about patients being unable to access their child's healthcare information because it's protected under HIPAA, even though it is their responsibility to care for their child. As with most things in healthcare, it could be improved upon, but for now, HIPAA is the reason that our current healthcare system works for most Americans.